Namaskar, I am Dr. Smita Moitra, Consultant Head Emergency Department, AMRI Hospitals, Salt Lake. So today I am here to remember the trauma victims, those who have lost their life on road, or those who are suffering with the after effect of trauma, those who have lost financially, those emotionally, and in line of that, we celebrate World Day for Remembrance of Road Traffic Accident Victims. Usually, it is celebrated on third Sunday of November every year. So we have senior panelists with us, Dr. Dibyendu Kr. He is a neurosurgeon, and Dr. Soham Mondal, Orthopaedic Surgeon, AMRI Hospitals, Salt Lake. So, welcome, Dr. Dibyendu Roy. So, as a neurosurgeon on road traffic accident, we have lots of injuries, polytrauma, where we have head injuries, spine injuries, or multiple injuries. So, what type of injuries you see on a regular basis, which has occurred on road or as a victim of road traffic accidents?
Most of the road traffic accidents that we see come to us with head injuries. They may be associated with other injuries like craniofacial injuries, which are the commonest association with head injuries. We also see some of the road traffic accidents coming with orthopedic injuries along with head injuries or spinal injuries who come along. Head injuries, head injuries that present to us are come with intracranial hematomas, which may be extradural hematomas or subdural hematomas, or they may have traumatic intracranial hemorrhages.
So, as a good civilian, or what we have the responsibility is that whenever we see a victim, maybe the driver, motorcycle accident victim, or the car crash injuries, the passengers, as a civilian, we have to come forward and help these injured people. So initially, to start with, we have to see whether the patient is conscious or unconscious. If unconscious, you have to immediately give life support, that is the compressions, chest compressions, which we usually keep on training, like the basic life support. And if the patient is responding, then we have to check whether there is any oral secretions or not, and we have to clear those secretions of the victims so that they may not further choke up with the secretions. Then coming regarding the circulation part, if you see that we have some of the injured parts which are actively or profusely bleeding, we have to control such bleeding part, and then we have to immediately, as early as possible, transfer the patients to some of the emergencies or the big hospitals where they are equipped with to care all the facilities there. At the teamwork, trauma as such is a team effort where we have to involve emergency, starting from emergency department to neurosurgeon, orthopedicians, blood bank, critical care specialist, followed by the individual maxillofacial surgeons, plastic surgeons, general surgeons, chest physicians, all come across as a team, and then we help them to have a good outcome overall after discharge. So I would like to ask Dr. Mandal how we can prevent such injuries on road and how we can help such patients.
First of all, in these cases, as we all know, prevention is always better than cure, because once a patient falls victim to a road traffic accident, we do not know where it is heading, because sometimes the outcomes are not very good, because most of them they present with head injuries, chest injuries, or multiple fractures in the limbs. So it's not a very good scenario to be in. So I would say, like, drive safe, as the Kolkata police also agrees. So drive safe, and like, definitely please do not drink and drive. These are the things. Be vigilant while crossing road. Don't do jaywalking. Don't go and cross any road without looking left or right. Be vigilant about your surroundings, especially, and please maintain the speed limits, because most of the crashes are fatal above 80 kilometers per hour. If you're not speeding, if you're below around, if you're below 60 kilometers per hour, if you're in the within the permissible limit, most of the times you might be injured, but mostly there will not be loss of life. So please do not speed, please do not drink and drive, and please be vigilant about your surroundings.
Dr. Roy, I mean, what age group or any gender specific victims do you find on road on such road traffic accidents?
Yeah, it is common to find males predominantly affected by road traffic accidents. And usually in our country, we see them between the 5 to 29-year age group, mostly between 16 to 29, 30-year age group, and maybe goes up to 35, but most common is 16 to 25-year, 29-year age group.
So, as per Dr. Roy, and we also know that most of the young generations, starting from the 18 years to 40, 45, is a productive age group, futile age group, where they suffer from such injuries. They have a loss of life, or sometimes they are disabled. They are functionally disabled. The family is affected. Yet usually, we should come out and help such patients who are in victim. And here comes the role of golden hour. Whenever you see a patient with road traffic accident, as early as possible, if the patient can come to a hospital, we can take over the patients, and so that the patients, when properly treated with all type of life care support or the surgery is needed, the outcome of the patient comes out to be good, so that these patients can live a good livelihood, and the family also has a good out. They are also emotionally helped with. So, Dr. Mondal, regarding the trauma to these patients, how come their mental situations are out after the surgeries or after the discharge, when the patients come to the follow up? So, what is their mental state of mind like that?
A very important point raised by madam. So most of the cases that I encounter, they require multiple sittings of surgery. So at the initial stage when we are counseling the patient, or if the patient is not in a position to be counseled, the family members, we tell them that multiple sittings may be required, and even at the end of the day we might not be able to save the limb. So when we tell that, definitely there is a huge kind of depression going on with the patient and with the patient relatives, because the loss of limb in our country, in our socioeconomic scenario, is still a very big thing. So people want, maybe they want a non-functional hand or a non-functional leg, but they do not want to lose their own leg. So that is a very important thing that we may have to keep in mind. And when they come back to us, we also try to boost them up mentally, because we see them like quite often, because they need require frequent follow-ups and maybe frequent surgeries as well. So we try our best that the limb is saved. Obviously that is our job, but in a bad scenario when it cannot be salvaged and it needs amputation, then we go for amputation. We want very fast rehabilitation, so we send them to the authorities who will give them prosthetic, who will train them to lead happy and productive lives.
So, post surgery, Dr. Roy, what is the role of physiotherapy in such cases?
See, especially in case of surgical post-traumatic cases, the role of physiotherapy is huge. Central nervous system cells are by physiologically they're permanent cells. Once they die, they do not regrow, they are not regenerated. So we bank on something known as neuronal plasticity, other cells taking over the job of cells that have died. And for that, physiotherapy is required to improve the function of the patient, so that the patient can be rehabilitated and go back to his or her normal life, go back to a productive life of work. Maybe it may require a job change or a change in field, but the patient remains productive and continues with his or her life. So, rehabilitation and physiotherapy are of prime importance in post traumatic neurosurgical patients.
Okay. So, Dr. Mondal, regarding the psychological help or the counseling sessions, how frequently these patients require or the family requires such counseling?
I think it's more of a collective counseling with the patient and the close family members who have direct contact with the patient every day. They require a collective counseling kind of thing, especially in scenarios where there is loss of limb. It takes around 2 to 3 months for the actual acceptance to kick in, and the patient finally comes to terms that he has to live his life with a prosthetic limb. and then I think they are more well versed with the scenario, and then they get used to it, and then finally they become okay.
Regarding, sir, road traffic accident, the pediatric, the child victims, how often you see such pediatric victims, child victims? Is there any special outcome or special injuries they sustain, or how much is this severe enough?
Yeah, actually, we do not see pediatric age group patients often because our hospital does not take pediatric patients. But from my experience, pediatric patients do come in. They're mostly due to falls. They are not due to road traffic accidents or the sporting injuries. Uh, Road traffic accidents may happen if they're in a vehicle which has met with an accident, but if the child is trapped in a car seat, they are less likely to be injured. One type of spinal cord injury happens in road traffic accidents in pediatric patients is called sciora, spinal cord injury without obvious radiological abnormality, which can only be detected with MRI, and X-rays do not provide you know uh, clue to what has happened, except the clinical. You suspect that sciora on clinical findings and then ask for an MRI to note what has happened.
Okay. So, coming to all the thing in nutshell, and can do you want to give some take-home messages regarding how to prevent such victims? We should not be. That is, the doctor said that prevention is better than cure. Anything additional you want to add?
Yes, I would like to see it's a message from the medical community to the total society, to the administrators. Please, the roads need to be in good condition, well lighted, and there needs to be proper adherence to traffic rules and laws. The administration has to strictly implement traffic laws. Drink driving should be discouraged and punished severely enough so that families are not destroyed. For the people themselves, please adhere to rules. Wear helmets whenever you're riding a two wheeler. Drive within speed limits, and please wear seat belts wherever you're sitting in a moving vehicle.
Thank you, Dr. Mondal. You want to add something more?
I think sir has summarized it beautifully. I think there are not many more points, but yeah, as I was saying previously, just be vigilant about your surroundings, because most of the times accidents are not at the fault of the person who is driving. Maybe it might be something else, some incident which has happened. So just be vigilant.
Okay. Thank you, Dr. Roy, Dr. Mondal, and thank you for people. Please stay safe, drive safe, and stay a healthy life. Thank you.